Martin.
Thank you, Mr Deputy President.
Can you give way to Mark Latham?
Earlier this month, I was pleased to join the Premier Gladys Berejiklian, the Minister for Health and Medical Research Brad Hazzard, and the Parliamentary Secretary for the Central Coast Adam Crouch at Wyong Hospital for the topping out ceremony for the new 6-storey clinical services building. The $200 million Wyong Hospital redevelopment will deliver an increase in overall service capacity and enhanced health services for the Central Coast community, particularly residents living in the northern half of the Central Coast. As a region, the Central Coast is expected to be home to an additional 95,250 residents by 2041, and much of this will be concentrated in new land releases close to the Wyong Hospital. The redeveloped hospital at Wyong will include a new emergency department, a new intensive care unit, a new psychiatric emergency care centre, a new ambulatory paediatric unit, a new and expanded medical imaging department, a new 28-bed medical assessment unit, and an additional 60 inpatient beds with future expansion space. The redevelopment also includes a refurbishment of the existing hospital to provide more operating theatre capacity, an expanded medical day unit and an expanded transit lounge. In addition, a new car park has already been completed with 320 additional parking spaces to cater for visitors and staff to the hospital, which brings the total number of spaces available to 500. Redevelopment of the hospital is on budget and construction is on track for the new building that should be complete in mid to late 2021. And the refurbishment to be finished in early 2022. 800 people will be employed on the redevelopment of Wyong Hospital, and it is particularly great that 650 of those will actually be Central Coast locals. Since 2011, more than 130 hospital and health facility projects have been completed, and nearly 90 projects, including Wyong, are currently underway throughout New South Wales. More than half of these projects are based in regional New South Wales. Another one of those projects is the new $470 million Maitland Hospital at Metford, where work is progressing extremely quickly. Main works only began in December, and I was pleased to be there in February for the first concrete pour for the main building, and the topping out ceremony was held there earlier this week, which I was very pleased to see the Honourable Bronnie Taylor could be there in person for. It's a remarkable pace of construction, Mr Deputy President, and the new hospital is on track to open in early 2022. The new Maitland Hospital will provide the infrastructure required to respond to the anticipated growth in the Maitland region. The new hospital will feature emergency services, emergency short stay unit and psychiatric emergency care, intensive care and critical care, medical and surgical inpatient services, perioperative suite, including enhanced day surgery, maternity services and delivery suites, including assessment rooms, paediatric and adolescent services, imaging and support services, day chemotherapy, mental health, including an acute inpatient unit, rehabilitation, and ambulatory care and outpatient clinics. Mr Deputy President, almost 5,000 new jobs are being created as part of the hospital redevelopment plan, which is supported through the Maitland Connectivity Centre. The centre, run by Multiplex, in partnership with the New South Wales Government, offers free training and job placement services throughout the project. I was able to open the centre earlier this year, and it is pleasing that it has placed nearly 50 candidates into employment opportunities on the project so far. I don't think we needed a 1 in 100 year pandemic to remind us of the importance of having a world-class health system. But COVID-19 has most definitely made us more appreciative of it. And I'm glad that we have a government here in New South Wales that is making record investments in health infrastructure like those at Wyong and Maitland. Thank you.
Greg Donnelly.
Mr. Deputy